Good morning, everyone. Thank you, Blake, for the invitation to be here. You know, myopia is probably the biggest healthcare disease thing that we'll treat in our careers. Many of you know the size of the problem, and it's not just in childhood. I think most of the patients we see have had PVDs, right? Um, and I'm a minus 10. And I had a PVD when I was 36 years old. I was in patient care that day. Thankfully, my buddy, the other associate doctor, and I, um, 2 lanes side by side, took an Optimap, took a look, everything was fine. Literally just this white string popped out of nowhere, and I'm waiting for it to happen in the other eye, right? And hopefully it's just as uncomplicated. But I want to share this video that our team at CooperVision made. We have 7 optometrists at CooperVision, and we all pitch in for this myopia effort here. But I just wanted to share this. Hopefully it'll play.
Hi, everyone from Rochester, New York. It's our Cooper Vision's team in the beautiful outdoors, 7 degrees and snowy.
Did you know that myopia, also known as nearsightedness, often progresses more in the winter months?
Shorter days means less time outdoors, and that means less exposure to natural light. It's still important to get them outside, even on a cloudy day like this.
More time spent indoors means that children are going to be spending more time doing year work activities like reading, be on their phone, things like that. And all of this can drive myopia progression.
Even more so, we got to stay consistent with our myopia management treatments.
So stay safe, stay warm, and stay proactive.
That in the background.
So depending on which part of the country you practice, you have one of us to support you in myopia, as well as 26 myopia reps, and of course, there are 200 or so other CooperVision reps as well. But where does this evidence come from? Actually, the winter thing was known back 20 some years ago with a COMET study. This is the more recent Blink study from Ohio State and Houston, funded by our tax dollars. And what you can clearly see is that the diopters of change are clearly more in those winter months depicted by the gray bars. And if you think about all those eye exams you did for children back in August, September, they may have had this winter progression, and it's about time to do something about it. Since we are in Vail, I did want to share this really adorable video of a 14-month-old snowboarding. Yeah. She looks a little scared. So cute. We have this saying at CooperVision that kids do hard things, and we'll come back to this theme. And then the Winter Olympics just wrapped up as well. But here's Alyssa Liu and some.
No. Nah. This is what it takes to become a champion. Constant pounding
I'm so tired.
in pursuit of perfection.
Or I saw that when you were training, and they're like, "Okay, that's good." And you're like, "One more,
Yeah.
one more."
Yeah.
You don't need somebody pushing
No,
you.
I have my own determination. My determination's up there.
You're pretty scrappy.
I love struggling, actually.
You do.
Yeah, it makes me feel alive.
I don't think any of us would say we love struggling, but this is what it takes to be an Olympic champion. And it's just a reframing of what comes across our desk and our practice and the patients and the staff, I think, in everyday patient care. So just think about Alyssa next time something we have to struggle through. This was me. When I was in first grade, I was likely -1. I didn't get my first eye exam, first pair of eyeglasses till second grade. At that time, I was already -2.25. And so could there be children in your community that think this is actually normal, clear enough vision? My college friend's daughter, she was also like me. She was -225 at her first eye exam. I was like, Emmy, how did you even see to know what the teacher's doing and to stay on pace on your learning? She's like, since I couldn't see, I just listened really carefully. Oh, it breaks their heart, right? Because they have to see clearly to learn efficiently. This is sort of the state of eye exams in the US. Anybody use GPN Edge Pro in the room? This data was de-identified and sampled from GPN, and this is 70,000 pediatric eye exams across 100 practices in the US. And what you clearly see with the blue bars is there's not a lot of eye exams that happen in kindergarten, first grade, and it starts to pick up a little bit. But I want us to think back, have we seen a second grader in the last month or two? have we seen a third grader? Because if they develop myopia, just like me and Emmy, that's up to a 73% chance they're going to be worse than -6 in adulthood. And we'll talk about like treatment goals to help us out here. Thinking about that third grader, my son is in third grade right now. I think Blake has a third grader too. Their myopia worsens twice as fast as a seventh grader. Said another way, the younger the child, the faster they get worse. Sometimes I describe to patients and their parents that your myopia is going at 100 miles per hour. We got to pump the brakes. We got to slow this down so that we can come safely to a nice stop later on in life. Now, it's probably too much to assume 49,000 ODs will do myopia control. So let's just say 40,000 of us are in family practice. Each of us, 40,000, would have 450 children with myopia to help. That's a lot. You got to start somewhere though, right? And then word spreads fast. So in the greater Denver metro area, there's about 3 million folks in the general population, about 363,000 children, specifically age 5 to 14. About 98,000 of those have myopia that ought to be treated, leaving about 78,000 MiSight candidates. If there's 78,000 MiSight candidates, how many are actually treated with MiSight today? And I'll take guesses. 2%. Quite a bit lower. It's actually only 938. So maybe 1.5 or 1.3%. Yeah, so we have our work cut out for us. And we can kind of march in this direction until hopefully at least 70,000 are helped. Are any of you part of this parent Facebook group? There's a lot of ODs that are joined and sometimes comment, mostly lurk. I'm one of the lurkers. I just read. But the cool thing about this is not only are there 24,000 parents talking about myopia control, about 100 parents join every single day. I'm just going to show you one post. This mom, Miss Jennifer, we were mismanaged by 2 practices before we found our way to this Facebook group. Makes me sad about the bottom one. We've been to 4 doctors in 4 years. And finally, the 5th one proposed MiSight. Right? I mean, how much myopia progression happens in 4 years? Remember what we said? If it's a third grader, they're going fast. This is an eye health problem. The National Academies of Science defined myopia as a disease, but that was not unique, right? The World Health Organization defined it as a disease 11 years ago as well. But if you think about all the work we do with AMD, diabetic retinopathy, glaucoma, like we are worried about painless vision loss because that's typically when it kind of comes back and bites us a little bit, right? But actually 43% of visual impairment will be due to myopia. It's almost as much as those other 3 combined. Speaking of standard of care, it actually was declared 5 years ago. I know next month is April. And the good news is we have MD support. So that means the Academy of Ophthalmology, World Society of Pediatric Ophthalmology, and believe it or not, the pediatricians as well. We've been showing up at the Peds Ophtho meeting. In fact, it's next week in Boston. And then the pediatrician conference happens in the fall. And here you can see Dr. Scarlett Constant, who is a pediatrician. Her children are treated with MiSight out in Florida. And she's a great advocate. And the optometrist, her kids go to Dr. Constant for their pediatric wellness and other things too. Okay, so here's that target goal. Imagine you're treating glaucoma. You want to start by setting a target IOP. Our target is to graduate kids from high school no worse than -3. That's when this myopic maculopathy risk begins to increase dramatically. Now, increased risk, it's kind of a statistical thing. Let me put it this way. Anybody in the room about a -4? No? That wants to admit it. Okay, if you grab all the -4s in the world, about 2% of them will get myopic maculopathy in their lifetime. Is 2% a large number, a small number? Well, 2% of adults get glaucoma, right? So I think both should be treated seriously. Because if you can save a 3 from becoming a 4, a -4 from becoming a -5, every diopter saved is going to reduce that myopic maculopathy risk by 40%. That's substantial. There's another Facebook group of patients living with myopic maculopathy. These are like minus 450s getting anti-VEGF and hoping that it works, because it doesn't respond the same way as wet AMD. So a common question, how long do we need to do this? An approachable answer, I'd say, is, Mom, we're going to do this a minimum of 2 years. And after that, we'll treat this every 6 months at a time, kind of reevaluate to see if we need to keep on going. A lot of us know we're going to treat for 3 to 5, sometimes 7 years. We just don't want to scare them away right off the bat, right? Because they're going to do the math. They're going to multiply that annual cost by 7, 8 years, and they're going to be a bit paralyzed. So what were y'all doing in 2019? This is a snapshot of our family. My daughter Samantha happens to share the same birthday as me. That's really special. My son Jake there on the right was 3.5, 4 years old when my site was FDA approved, and look at them now. This was on our Christmas card, yeah. Okay, so we've been FDA approved with MySight one day for coming up on 7 years, and Stellest joined the party about 4.5 months ago. How many of you have prescribed the pair Stellest? Anybody? Yeah, great, cool. How many a week are you kind of averaging? Probably ebbs and flows, right? Maybe once every other week. Yeah, yep. So let's look at it this way. MySight, our power range goes from minus 0.5 to minus 7. So we can address about 13.5 million of mostly spherical myopes for children. But because Stellest goes all the way to minus 10 on the highest meridian and all the way to minus 4 for cylinder, they can address 18 million. And that difference is kind of shown in this Venn diagram, if you will. So it's great because EssilorLuxottica has a lot of money to further our awareness that we've started in 2019. And guess what? Stellest patients are going to be pretty active in performing arts and sports. I talk a lot right now about spring tryouts. Gosh, yesterday at the bar, we're saying like 3rd grade is where sports becomes really competitive, a step up from 2nd grade. And think about the spring musical, and hopefully not having to wear glasses while you're performing and singing and dancing and moving around. There's an OD out in Texas. She said, when I was younger, I did ballet. But the ballet troupe did not allow me to wear my glasses on stage. I was minus 4. I had a hard time like seeing where I was going. It was a lot of muscle memory. And thank goodness, speaking of what Dr. Theus was saying, that she didn't fall while trying to do ballet as an uncorrected minus 4. So think about contact lenses for spring tryouts, not only in sports, but also performing arts. Our efficacy is pretty much the same. You might say 71% control is a lot better than 59, but it's only 1/10 of a diopter difference. That's less than half a click on the phoropter, right? And our axial length control, which tends to be more accurate, axial length control is exactly the same between Stellest and MySight. But I do want to spend just a bit of time talking about like compliance while wearing glasses. I think most of us in our day-to-day practice and our opticians will tell us, man, compliance isn't great. Like they show up to their eye exam without their glasses. The compliance rate is 40%, which means the non-compliance rate is 60%. Most common reason is broken glasses or lost glasses. Did they stay in the backpack? Did they ever make their way back from school? Are they in the couch cushion? Where are they? Why are they not on your face? And that matters, as you can imagine. This is the Stellest study that was done in China many years ago. They found that kids that wore their Stellest for 12 hours a day, they got a lot better myopia control than the kids that only wore their glasses about 11, 10, less than 12 hours a day. So 40% of those children were part-time wearers. You're going to get partial results there. And there's that measurement of axial length showing, yeah, part-time wearers progress 50% more. It's kind of like if I take my metformin every other day, I'm not going to get the treatment result that we hope for. Yeah. This is in the Northeast, all these elementary schools. They were doing vision screenings from pre-K all the way through 12th grade. Similar thing, the vision screener would like, all right, child, you're next in line. Do you wear glasses? They're like, yes. And they're like, why are they not on your face? So 40% of the time, the kids reported they were prescribed glasses, needed to wear glasses, but they were nowhere to be found, right? Who knows why? This is a really cool objective way to measure how kids wear their glasses. Think about a pair of glasses where the inner temperature sensor touches the face, it's going to be warmer. And then there's an outer temperature sensor on the other temple that's going to read the ambient temperature in the air. So anytime there's a differential in temperature, it's on the face. But if it's on the nightstand or at home, it's going to read the same temperature both on the inner and outer part here. So this child took their glasses off at 6:45 p.m., maybe for a shower or dinner, I don't know, and slept from 11 p.m. to 6, 7 a.m. there. What the conclusions were is that boys, they wear their glasses less than girls, about 90 minutes a day less. The children that are -1, we all know that if they're -1, they get home or they're indoors, they can see fine. You know, they're not trying to read 2020 fonts, as an uncorrected -1. And then as the children got older, they also wore their glasses less and less. So these are real challenges that we have to be aware of. And at those 6-month visits, right, we have to recheck compliance. And at a 2-week visit, making sure things are lined up well. All right, let me ask you this. What % of kids do you think break their glasses within the first year? Shout out some numbers. What % of kids break their glasses? 35%. 50%. Okay, all right. Well, Dr. Schutz has a peds-only practice in Indiana, and she guessed 50%, but she had her opticians count up all the frame warranties due to breakage, and you nailed it. It's 37%. Yeah. So what do we do when it takes about 13 days for the Stellest lenses to turn around? We have a MySight Fit set, same-day dispensing. It's one tray. You know, while they wait for that order, if you don't have atropine, you got to help them while they wait for their Stellest lenses to come back. Thankfully, with MySight, kids love contacts and they wear them 14 hours a day at 7 a.m. to 9 p.m., which is essentially my third grader schedule, right? 7 in 10 parents said they do struggle with reminding their kids, wear your glasses, wear your glasses. And every time you ask children that wear contact lenses, 9 out of 10 prefer their contact lenses over glasses. So it's kind of like a no-brainer. It's that built-in compliance that can help everyone out. We won't talk about the optical design too much. Just know it's not a presbyopic multifocal. And the whole idea is to move that light signal in front of the retina to get it back on track for the growth rate. 7-year study. All this is showing in the blue brackets is that when you start MySight earlier, you can save a heck of a lot more eye growth and eye stretching just by starting a year sooner than you would have. The response rate of MySight is really good. You know, it's going to work 9 out of 10 times. Let's pair that up with latanoprost, which only works 85% of the time. 0.02% atropine in the CHAMP study only worked 22% of the time. And then back to metformin, which actually, surprisingly, only works 57% of the time to get the A1C in a better place. So 90% is looking pretty good. I'm just going to show you a case example of Olivia and Madeline. They are 8-year-old twins out in Southern California. They are no longer 8 because time has gone by. But Dr. Rogers started treating them at -0.5 level. Take a look. Olivia has not progressed a single click, and Madeline only went up a quarter diopter. It's conceivable they can pass their driver's vision test uncorrected because of the good control we got them in 3rd, 4th, and 5th grade. Not only that, they teach other children how to put in and take out contact lenses. It's so cute, and it helps the child say, wow, Madeline looks like my age. Or the parents like, they're too young for contacts, but hold on, they can do it too? So it really helps both the parent and the patient buy-in. Sophia over here is also teaching INR in Spanish. So these are all freely available on the MySight YouTube channel for you and your staff to use. Remember I said kids do hard things? I know like this day and age, like There's more slip-on shoes, but typically like soccer cleats, football cleats, you still have to tie your shoelaces. And that's actually a lot of finger coordination and finger strength and isolation, a lot of OT skills. My kids are building Legos from a very young age, and that's not easy. They're having to take apart and do that visual perception thing with the instruction book. And both of my kids started piano at the age of 4.5, 5. So I learned that playing piano is about putting your fingers in the right place. And then so is this, right? Wrong place. Okay, eyelid margin, get under the eyelashes, right place. And the younger children actually follow directions better. They want to make adults proud. We sometimes don't give them enough credit for what they're able to do. So if you go back to the practice and talking to mom, dad, and the patient, this is my friend Dr. McHugh in Buffalo Grove. She said that the mom was having a hard time with INR in the 8-year-old, but her mom's reminded her daughter, you can do hard things. And the rest of the week went swimmingly well. That's great. So yes, vision is great in my sight because it's not 20 happy. They actually see 2015. I'll say this, we have a lot of varsity baseball players wearing my sight. They can see the seams on the fastball. There's a Canadian Olympic athlete that also wears my sight. If it's good enough for Olympic performance, I don't know what to tell you, right? That takes the cake. We have doctors starting as young as 4 years old with my sight. Now, the parents are helping to put it in, but the child's able to remove it very easily. We already said that. And as a daily disposable, just remind the parents, we have lots of kids in our practice safely wearing contacts, and you're throwing away that bacteria every single night. So what if my patient has astigmatism? Well, we have some off-label options. We have bioaffinity toric multifocal, 250 ad D lenses. We have CRT dual axis. We don't really need atropine anymore because Stellest also addresses astigmatism, right? So we're in a pretty good spot in 2026. In the last 5 minutes, I want to just hit on a couple more things. We have cataract conversations with our patients almost every day, don't we? Typically, that takes about 54 seconds, but we can do the myopia conversation in about 35 seconds and do it well. I think that's the difference, right? Because we know this is true. The longer we talk, the worse the outcome because parents are tuning out, it's information overload, and if they have paralysis, they're going to have decision paralysis, and it's said that confused people don't buy anything. They just don't move forward. So try your best not to go pros and cons of MiSight, pros and cons of bioaffinity, pros and cons of atropine, pros and cons of Stellest. That's going to way overwhelm them. Give them the information. They're going to look things up anyways, but lead with what we want to be best for the child. Keep it simple. A lot of the times the parents will be nodding their head and you think they understand, they're just being polite. So we have to make sure that we connect in a meaningful way. So the way we do that is redefining the problem of myopia. Hey, Mrs. Kwan, Jake's eyes are growing too long, too fast, and they're getting weaker. This is actually why he sees blurry, but this too fast thing is stretching the eye out, and this is the concerning problem that we want to stay on top of. We want to treat as soon as we can. When we interviewed parents, like, your doctor told you a lot of information about myopia control. What do you remember? And sure enough, they said, when I saw the longer eye from the shorter eye, I didn't want the longer eye for my child. That stretching didn't feel good, right? So don't have them read the whole thing, but just show them one picture. We all are visual learners. That's kind of why we have PowerPoint, right? But make that visual connection to the redefining of the problem. MiSight has great value. It's a 2-in-1. It's going to help your child see clearly to learn in 3rd grade. It's also going to keep his eye from getting worse so quickly. And the beautiful thing is that Jake is going to do so much better on the football field instead of sports goggles. He's also going to enjoy Taekwondo so much more. You want to contextualize it to all the great information you learned about this 3rd grader already. This is a good closing statement. You say, hey, Mrs. Kwan, my job is to protect your child's vision from getting worse as they grow. Let that sit for a little bit as well. But when you're doing your job, you're not selling an expensive program at the moment. You're just trying to be an A+ optometrist. You're trying to do that standard of care. The word protect obviously resonates with any of us who have parents. We protect our children from harm with seatbelts, helmets, the right car seat at the right age. I hold my kids' hands while we cross the street. So we're hardwired to protect our children, aren't we? One doctor told me, I make sure my kids hang out with the right group of friends. That's another way to protect them, minimize the harm that can happen with bullying and just how hard it is growing up, right? I learned this from Dr. Austin Gregory. He's like, a lot of things in optometry feel optional. Should I get the 167 or the 160? Should I get transitions or not, right? But this is healthcare. We're treating a disease. So maybe, Mrs. Kwan, my job is to protect your child's vision from getting worse as they grow. At the end of the day, this is really important for Jake. And then let that sit for about 2 seconds, right? Kind of just stripping away the optional stuff in optometry and then honing in on what's actually important. Just to highlight that for the parent, right? Just highlight. You might say my sight's really expensive, but there are actually 7 daily disposables more expensive than my sight. If it comes to that point and say, you know, Mrs. Kwan, this treatment's about $3 a day before the rebate, it's gonna be about $2 a day after. Seems a lot less intimidating than 1,500 bucks, right? We don't have a lot of time to go over revenue per hour, but just know that if you're in a 2.5 FTE or 3 OD practice and you close the office for holidays and vacation, you're making about $564 per OD hour. And looking at my site for 300 professional fees and 1,200 annual supply, you're actually making $3,600 per OD hour, not staff hour, per OD hour. If you do the math, it's about 7 times more revenue per OD hour. Okay, last parent question. You know, this is a lot of information. I need to talk it over with my husband. We're gonna get back to you. Did they ever get back to you? Not usually, right? But can we wait to see what happens? Maybe he got worse and maybe next year he won't get worse. But I hate to break it to you, 96% of kids get worse as they grow. You're not gonna tell that to the parent necessarily. That's just for us. We know that, we see that. But let me give you a good tip about being time bound. Okay, Mrs. Kwan, we can wait. We don't have to start today. This is a lot of information, acknowledge. You're gonna need to pick up your Stellus or you need to pick up your glasses in about 2 weeks. Let's revisit it then. Or the only thing I don't want to happen is that we wait a whole year and the myopia gets worse and we can't take back that time. Is it all right if we start treating by spring break? Is it okay that we start treating when school gets out in June? That way we kind of dial up the urgency, but again, make it approachable, like the minimum of 2 years thing, right? So using a couple of things from Atomic Habits, put the sheet or put this by the autorefractor. When your pretester measures any amount of myopia, yeah, they'll be over minus, I know, but just give this to the parent. Parent's gonna hold it. They may not read it. They're gonna sit down in the corner exam room chair. And when you walk into the exam room, you're like, hey, Jake, how's the last year been? What sports are you doing? You really quickly see that the mom is holding something bright. That's gonna keep you more consistently educating on myopia control. And please, for yourself and your ODs, document in the assessment and plan that you talked about myopia control treatment. All right, so we might hear no 5 out of 7 times, then 3 out of 7 times, and eventually you can get really good, starting the week of March 30th, I think. It's all about showing up, being physically present. Sorry, I'm like tying in all these like TJ emotional things. And then you'll be more successful the more you do. So to kind of close, I would say myopia control is the right thing to do because it's standard of care. It's gonna be the smart thing to do, not only for revenue per hour, but think about the 5-star Google reviews. Think about your reputation in the community. It's gonna go a long way as these parents are chatting in the bleachers, as they join that Facebook group, hopefully, maybe not. But at the end of the day, I'd say myopia control is the best thing to do, simply because the smiles on the kids' faces just never gets old. A lot of doctors, they just feel so like excited and it's so rewarding to get to see these kids grow up, not only just once a year, but every 6 months. I think that just brings a lot of like job satisfaction in my mind. So with that, thank you so much for again having me for this session. If you don't have a MySight Fit set, if you need some of these things, I have some business cards. Just reach out. We'll connect you. We'll send all these things for free and get you going coming out of that winter myopia progression. Take care. Yeah, you bet. I made up a little bit of time, I think.